It's not often that a rash will land a child in the hospital.
It was just the skin. He was his normal, cheerful self.
But when 7-month-old Max Gumbel's chronic eczema suddenly erupted over a 24-hour period, a call to a nurse helpline prompted his parents to take him to the emergency room.
And then this morning when he started getting it in his mouth, I think that was the clincher.
Right there, in the middle of Max's tongue, is the telltale blister. The diagnosis, hand, foot, and mouth disease, a common condition usually appearing in children under 5 years old.
What happens is kids will get a fever, they may not feel well, and then over the next few days they'll get more symptoms.
Max's pediatric dermatologist Megan Tollefson says because of his eczema, a round of tests was quickly ordered up to rule out other conditions such as chickenpox, a staph infection, or the presence of the herpes virus, which can create more serious complications. Dr. Tollefson says another situation may also require hospitalization.
One is if there are so many sores in the mouth that they couldn't drink and they were getting dehydrated, and they would need to be in the hospital for fluids, basically.
Interestingly, tests revealed that Max had contracted a newer, more aggressive strain of hand, foot, and mouth virus. First seen just a few years ago, it often causes a more widespread rash on the torso, arms, and legs.
Kind of the mystery to me was he was getting it on his hands and in his diaper, where he had never had eczema before.
Considering the other possibilities, however, Jennifer says the diagnosis was actually a relief. Because it's a virus, Dr. Tollefson says in most cases there's little to do beyond letting it run its course.
So just trying to get kids to eat and drink as much as possible, and if they have a fever, to give them medicines like Tylenol or ibuprofen to help with the fever.
For the Mayo Clinic News Network, I'm Dennis Doda.